want to listen and then there's going to be a link later on where you can watch the event at the time you want to watch it. And for people who didn't have the chance to be here this morning. So this is an official statement. This meeting is being recorded. And if you have a picture of yourself without a name, it would be nice that you add your name so that anybody can address you and that you can address anybody else. So it's communication all the way around. So once again, I want to say good morning to you all, ladies and gentlemen, dear colleagues. I'm very pleased that you are participating in this event, launching the European Academy of Clinical Leadership. This is a great day for us because it marks the end of a long time of preparation of this academy. And at the same time, it's the official start today, the 17th of September, 2021. First, I want to thank all members of the working group of the European Academy of Clinical Leadership who did great work in the last years. I want to say thanks also especially to UEMS because your support and help is vital for the success of this ambitious project. I'm very honored that the president of UEMS, Professor Papalois, is co-chairing this event. And I'm also very pleased and honored that Professor Krajewski is also present during this meeting. Thanks to all European medical organizations that cooperate with us. A very warm welcome to José Santos, the president of CEOM, to Joano de Deus, the president of AEMH, and to Matthias Körner, the president of EJD. All these three organizations are partners and supporters of the Academy. I'm very happy to have their representatives with us today. A warm welcome also to all representatives of European medical organizations. To Alexandra Ashu-Dokoulakis, Vice President of EMSA, to Kalim Bumbulut, President of UEMO, to Sarah Dash, Deputy Secretary General of CPME. Now I want to give a short introduction of the structure and history of a European Academy of Clinical Leadership. I need screen sharing, yeah. Okay. Now, a European Academy of Clinical Leadership. Can you see the screen, Diana? Okay. Yes. It is a project of AEMH and in collaboration with UEMS. What is the reason why we are having this project? We think, and I think everybody present thinks this also, clinical doctors are in the center of the clinical leadership activity because of their competency. We are the clinical leaders in hospitals and clinical and medical institutions. In the past, it was usual that hospitals were led by doctors and not by people who were not doctors. In modern times, the modern option tends to favor trained managers, most frequently non-physicians, to be in these positions. You all have this phenomenon in all your countries that the managers are taking over who have an economic or whatever background. An increasing body of evidence shows that appointing the physicians into leadership positions secure improved hospital performance and improve patient care. More clinician participation in hospital management is equal to increased organizational performance in terms of care quality, efficiency, lower morbidity, increased patient satisfaction. And that is why, after some discussions, we decided in 2016 in Naples to focus the work of AEMH on the subject of clinical leadership. And so we founded the working group, and we thought about the way to construct the whole academy. And the template of this academy is the UEMS bodies and ETRs of UEMS bodies. So we tried, and I think we succeeded in adapting and adopting these templates from UEMS. And then the work went on. We had lots of continuing conferences on clinical leadership in small circles and in bigger circles. Now, who are the members of this working group? The president of AEMH, the first vice president, Sergio Bovenga, the treasurer, João Grêmio, who's also the secretary general of UEMS at the present time, the second vice president, Karin Bartelsen, the third vice president, Konstantinos Koumakis, and then the president of FEMS, João de Deus, who was the president of AEMH for 8 years before me, and then the former AEMH treasurer, Jobbes Sobat, and the former AEMH first vice president, Vlad Ticke, and then Professor Rainer Riedel of Renanian University in Cologne, and president of EJD, Matthias Körner. So this core team did most of the work, supported by our dear representative and Secretary General, Diana Voicu. What did we construct up to now? We formulated training requirements for senior doctors with clinical leadership to experience to become a fellow of the academy. And we, at the same time, wrote down training requirements for trainees for younger doctors. But this is going to be discussed later on this morning. So the governance, the Clinical Leadership Academy is governed by AEMH in close collaboration with UEMS. The academy is managed in collaboration with other EMOs, FEMS, EJD, CIOM, and universities from different European countries. The management of the CL Academy is done by the CL Academy Board. And today we are launching this academy officially, and all the information you want to have is going to be available on the website of the academy. So thank you for your attention. And now I want to give the word to Professor Papalois, who is present, and I'm very honored and pleased that he is co-chairing this event. Please.
Thank you very much, Dr. Meholtz, for this most kind introduction. It is an honor and a pleasure for me and for our organization to be here today and co-chair and co-organize this event and the Academy with AEMH. A very warm welcome, first of all, to all colleagues from all over Europe and way beyond Europe, seems to be the case. On a Friday morning during working hours, we have already almost 90 colleagues attending, which is absolutely fantastic and testimony to the importance and the quality of this event. What I would like to say on behalf of the UEMS is that we are extremely pleased and proud to be part of this enterprise in collaboration with AEMH colleagues and other EMOs for a variety of reasons. First of all, because the UEMS strongly and passionately believe in European collaboration and integration. And as I have said many, many times, there is a very well-tested alternative to European collaboration and integration, which is a European catastrophe. And nobody in the world wishes to go back there. So we believe strongly in that. And European collaboration and integration means that we learn from the experience and expertise of all European nations over centuries of history, and then we try to unify these in a harmonized view as to how we see the future in our vocation when it comes to our practice, our medical practice, and the way we can advance it for the benefit of our patients. So this is the first reason. The second reason we are very proud is because we also believe strongly in collaboration with other European medical organizations, not only as a matter of principle, but as a matter of practice. This is testimony, this academy, to this, to our belief in this principle. So all European medical organizations serve exactly the same scope, which is to advance medical practice and help patients across Europe. We do it from slightly different perspectives, and this is where we can come together, complement each other's competencies and experiences, and advance the field. So we are very proud and very grateful to our AEMH colleagues for their collaboration in this, in a very practical level, and to other EMOs, and hopefully more to come. And the last reason is because we do believe that clinical leadership is massively important and equally important with clinical and academic competencies in modern medical practice. And by defining a clinical leader, and Dr. Merholz was very clear about it, we don't only mean the one individual who will be head of a department or head of a clinic. Each and every one of us can be a clinical leader on a daily basis in what we do and with the people we work with. And I think the Academy comes in a very practical and pragmatic way to serve this purpose across Europe. Very promising. Grateful thanks to all colleagues for all the hard work they have done, and we're looking forward to a very, very interesting webinar. Thank you.
Unmute
You're muted.
microphone.
Theo, du bist stillgestellt, gemutet.
Thank you very much, Professor Papalois, for your warm introduction and your help preparing and doing this meeting. And I'm very happy to have UMS with us because, as I already showed you, the template of this academy is the structure, our structures of UMS. So I'm very happy to thank you once again for your introduction and support. Now I want to introduce Professor Vlad Tica. He is Professor of Gynecology and Psychotherapy at the University of Constanța in Romania and has moderated our work of the working group since the beginning. He's a very experienced moderator. That is why he is going to present this webinar. Dear Vlad, now it's your turn.
Thank you, Mr. President. Thank you, President of UEMS, and very welcome, warm welcome from Constanța, Romania to all of those participants. And I see friends' faces, and I'm very happy to see new ones. So now the structure of this launch will be some presentations, and we have some prestigious presenters. We had our president, Theo Merholz, who will also present, and he's a seasoned and experienced executive and professional medical organization in Germany and in Europe. We have João de Deus, who, as our president already said, is the actual FEMS president and the former president of AEMH. He's a professor of ophthalmology at the University of Lisbon. He is the head of ophthalmology department of a private hospital in Lisbon, senior consultant of ophthalmology in a public hospital in Lisbon. He is the former member of the board of the Portuguese Medical Association and director of international department of this Portuguese Medical Association. We have our dear colleague Freud Sobat, who is head of the radiation oncology department, former president of the Croatian Medical Association, and former president of International Committee of Croatian Medical Chamber, and he has served the AEMH as a treasurer and board member for 9 years. We have also, we already heard him, Professor Riedel, Professor Rainer Riedel, who is a very valuable asset, if I can say, because he's a professor of really leadership. And we have also João Grêmio, who is consultant in surgery, but not only he is an expert in what we are dealing with, but also a link, a very valuable link in between AEMH and UEMS, as he is the AEMH treasurer, but at the same time, he is the UEMS general secretary. As by myself, I'm a university professor in Constanța, Romania, and visiting professor in London and USA. I'm a chair of the OBGYN department, president and vice president in different national and international societies. I have a master in management of health services. I'm a psychotherapist, as our president said, and licensed neuro-linguistic programming practitioner, master, and integrative counselor. And I'm an international trainer in leadership. I will begin, and we will begin first with a very logical approach. And this very logical approach would be why we are here. Why do we need this academy? And I will just very modestly continue what the presidents of AEMH and UEMS already said. And for this, allow me to share some slides. Right. So I will just skip the fact that by difference of the past, the modern, I don't know why. Okay. So even if in the past hospitals were managed by doctors, now it is not the case. Well, a very important report which was issued in UK, the Darcy report, the famous Darcy report in 2008, which was issued because of problems in one region, we can come back on it, said very, very clearly that we have reasonably to expect that the doctors have the powers to affect the outcomes. So we as doctors should be empowered to set directions and to make decisions on the resources and on people, which is also a resource. A plethora of significant and high-rated institutions, academic and professional institutions around the world, said that this is a very important issue, and you can see here the Medical School Council, General Medical Council, Conference of Postgraduate Medical Deans, the Academy of Medical Royal Colleges and NIH employers. I think that some of the words which are here in blue are essentially important, as a doctor must be capable of both management and leadership. And as Professor Papaloi said, when we say leadership, it doesn't mean director or manager of the hospital, but at all levels in relations with authorities, organizations, and patients. Not only that, in the States, the Medical Association asked the Supreme Court to protect the medical board powers, but another report in UK later on in 2013, because of failings in a hospital, said that what happened if clinical leadership was not really ensured by doctors. And as you can see here, one of the very most important reasons was the disengagement of senior clinical staff from managerial and leadership responsibilities. Now, if we already said why it is important, because it was a change in the management, why it is important, because what happens if it is not ensured by the doctors, then let's see what advantages, what are the positive effects if the leadership is done by doctors. And then we have several studies which are all going into the same direction. The Kaiser Permanente Colorado, I assume that you know, it is one of the largest providers of medical insurance and services in the States, said that the clinician, as a healer, ensures, or as the result, satisfy patients, decrease staff turnover, but also the income, which was rose to almost 100 meals. And another US important organization, which is the Veteran Health Administration, stated that clinical leadership had for them some really important results. One, health, as the main risk of death that is almost half as the US average. And they said that clinical leadership had a very important effect on these figures. The patient satisfactions rose to 12% more than the US average, and the patient number doubled in 1 decade. As you can see here, the National Coordinating Center for NIH Service said that organizations with a stronger clinical leadership are more successful in improving the services. And the Academy of Royal Medical Colleges also stated that if we have clinical leaders as CEOs, we have organizations who are really more performing because engaged clinicians in dialogue and problem solving. And you have here a very large number of citation of references who all go in the same direction. This direction is that if we include physicians into leadership positions, the result is improved hospital performance and patient care. And there is also figures, we have some figures, which is 50% higher performance. And we have large study, the cost study in 2012, which concluded that if we have a higher percentage of doctors in the board, significantly increases the performance in terms of different areas. And we are not speaking only in care quality, morbidity, but also in efficiency, which is a managerial act, and increased patient satisfaction. We have, as I promised you, another figure, which is 25%, that is a quarter of 100, higher performance in physician-run hospitals. So, dear colleagues, if I would like to summarize what I said, why we are speaking about clinical leadership and why we think there is a need of training within our ranks, I would say that clinical leadership provides legitimacy, credibility. It bridges between organizations and clinicians, brings specialist knowledge, and brings political capital. And this would benefit, would be really a win-win-win situation, because our patients will take advantage, we will be more satisfied, and the organizations, the structures, the institutions would be better managed, better led. I hope that in this very short time, I could tell you some words of why we are here. Thank you.
Thank you very much, dear Vlad. And you are really enlightening our program, because these facts, they are evident. They are self-evident that doctors are born and even the better leaders. But I want to ask now Professor Riedel, who is going to be the next speaker. And I give the word to Professor Rainer Riedel.
Good morning, all.
ჩასულივარ მიტინგში და ფაქტიურად ვიჭერხები საშინელება. ერთ კლინიკა ერთი დაწესებული ვერაფერს ვერ იზამს თუ ქვეყანაში რაღაც არ დავარგო.
Dear President, dear Chairman, thank you very much for the invitation. And I want just tell you why clinical doctors in leadership positions should work over the bridge to more or less become an excellent clinical leader. And I just want to tell you the reasons why we should go over this bridge. What is clinical leadership today? At the end of the day, you are really excellent clinical specialists. You're leading your teams. You're responsible for the quality of medical measurements. And at the same time, you are confronted with economical and other key factors. So clinical leadership is the key for promoting high quality clinical care and also the reputation of all your clinical staff and your institution. So clinical leadership is your general success story, and it's including strategical level, high performer as a clinician, personal qualities as a front man or front woman, digital innovation and integration and leadership skills. And you are more or less, if you see on the right side, a personality which is delivering services, and you are every time more or less a key personality in your team. Quality of healthcare services. This is your original personal goal. When you left your university, when you went to your special clinician field, and you were more or less educated to fulfill a special high performance in medical care, reducing complication rates, being more or less focused on risk-adjusted mortality and mortality rates. And you are at the same time as more or less the manager of a clinical pathway of the patient. Additionally, you are more or less regarding everyday evidence-based medicine in your clinical job. But as it was pointed out by our president and by my colleague Tika, you are also confronted with financial and operational resources by the general manager of your hospital. And every time it's just going ahead with profitability of the unit, of the operational efficiency, and last not least, it's going ahead with cost-effective clinical guidelines. This depends on the country we're working in, and they're different in Germany or Great Britain, France or Greece, for example. Additionally, you have also the challenges to organize your staff. You have different people in your team. You have nurses, you have doctors, you have administration people, and at the end of the day, just during the COVID-19, we were just getting aware that we have to more or less regard the requirements of work domain home balance for all our people in our team. That means people are more or less working sometimes more than 8 to 10 hours a day. You have sometimes lack of people, of specialists, and this is really a challenge that people are getting enough time for relaxing. And during the last years, we have another challenge, the integration of digital transformation. In Germany, for example, the hospitals have to introduce digital technology till 2025. And if you don't do it, your reimbursement rates will be reduced up to 5% in each patient case. So these items I just mentioned means that we have to be able to handle Kaizen. Kaizen means to develop our clinical department in a positive way. Another perspective is personal qualities, ethical perspective, legal and social performance. Doctors in clinics are more or less regulated by legal and social performances. And also we have the daily discussion about ethical processes we have to regard. But this topic, it was essential, and we more or less learned it from the first day of our medical education. So looking on these 4 topics, we are more or less getting acquainted of the situation that clinical leaders are also an integrated part of social and ethical legal developments in a society. What means clinical leadership? Clinical leadership means also just looking in total, integrating digital domains, integrating economical domain, being aware that our people in our teams are more or less living in a balance of work, domain, home balance. And our more or less main domain, the medical expertise, and this is your daily work. And the last mentioned position, PELS domain. This is more or less the decisions level you're confronted every day. During the last years, also, we have the integration of health technology assessment. The more or less requirement that new technologies has to be introduced in your team, in your medical decisions, and at the same time, we are up to a certain point regulated by economical borders. We can't introduce each new clinical, medical, therapeutical innovation because up to a certain point, it depends on the more or less reimbursement system we are working in, that HTA reports more or less limiting the introduction of these new technologies. But this is also one step you have to be realized and have to integrate. Looking on these total items, clinical leadership today and for tomorrow is one very important step to be improved, because we have to inspire our people, because only motivated people, they're excellent in their daily job. Every people and every person in our team, just if it's a young personality, is motivated in a high way. But by the daily work in the clinic, it may happen that this motivation may decrease. And our job is it to inspire people to be more or less motivated the whole working life in our team. Being very empathical clinical personality regarding the just mentioned management challenges, being a very important strategic manager, being a high performer clinician that you are every day, But at the same time, we have to be an economical manager, more or less. We are not acquainted to, and we are not more or less willing to only more or less limiting our medical training and medical measurements by economical regulations. We have to integrate the digital transformation. We don't know what it really means. One advantage could be that the clinical pathway could be more or less reducing administration steps in the process, but at the same time, we have to more or less train our people for digital transformation. Then we have also integrate health technology assessments. Only to give you a feeling of the situation. By the situation of the pandemic of COVID-19, the German social healthcare system more or less lost additionally 20 billion of euro. So we are now discussing how to finance this more or less amount of money during the next years. And this is more or less than limiting the introduction of new technologies and new drugs in the therapy. So the question of the reimbursement possibilities in a system is also one topic of clinical leadership. Thank you for your attention. So, dear President, Theo Mehrholz, as I told, I have now to switch to a internal meeting, which is just running already. I'm sorry that I'm not participating the next minutes, and I hope I'm coming back till the schedule was more or less planned during the next hour. Thank you for your understanding.
Thank you, Rainer, very much for your interesting presentation. And now I pass the word back to Vlad Tika. By the way, all questions are going to be discussed after the presentations. We got enough time to handle all questions which might pop up. So just write down your questions and use the chat. Dear Vlad, it's up to you now. Dear Vlad, Professor Tika, are you lost in transition in the web? So I think there's some technical difficulty, so I continue to introduce the next speaker. It's going to be João de Deus, the president of FEMS and the former president of AEMH, and a well-known European health, politician, I might say, because you are having lots of experience in handling European affairs, and I'm very happy that you're a member of this working group and that you are now going to present the European training requirements for senior doctors with clinical leadership experience. That's the group which is present right here, and I think it's most interesting for many of us to hear which possibilities there are, which possibilities do exist to become a certified clinical leader. Dear João, please start your presentation.
Thank you very much, Theo. Good morning to you all. I'm going to share the screen. Okay, I hope you can see it. So this is one of the ways to access to the Clinical Leadership Academy. And these are the training requirements for senior doctors with clinical leadership experience. This fellowship applies to doctors who have completed their general professional training as physicians, have experience as clinical leaders, and wish to be recognized by the European Academy of Clinical Leadership. So who can apply to this? I'm sorry, not able to pass the slides. Okay, now it's, who can apply? So doctors could be hospital managers, could be clinical directors, could be a chief of an emergency team, could be a chief of a family medicine unit in primary care, could be a head of a department. So for these applications, there are two parts. One is the CV evaluation, and the other one is the project of management of a medical department. So for the first CV evaluation, the doctors must demonstrate personal qualities and also leadership skills. So for demonstrating personal qualities, doctors showing effective leadership need to draw upon their values, strengths and abilities to deliver high standards of care. This requires doctors to demonstrate the competence in technical professional skills, and first of all, the professional paths, the relevance of the experience acquired, training and type of functions performed. For example, in surgery, the number and variety of surgeries performed. In second place, the continuing personal development. So the participation in CPD activities, experience and feedback of those activities. In second place, the time spent in practice. So for how long the doctors has been working as so, developing their activities. First of all, developing self-awareness by being aware of their own values, principles and assumptions, and being able to learn from experience. And second, acting with integrity by behaving in an open, honest, and of course, ethical manner. And in third place, the educational activities as a trainer. The training activities in medical internship or other training and medical education courses attended and given, and also as member of juries or other activities connected with training. And also managing themselves by organizing and managing themselves while taking account of the needs and priorities of others. The second part is leadership skills. So doctors show leadership by working with others in teams and networks to deliver and improve services. This requires doctors to demonstrate the competence in experience, capacity, and ability to manage teams. Working within teams, building and maintaining relationships by listening, supporting others, setting direction, gaining trust, and showing understanding. Also, the experience and capacity and ability to manage services as head of medical departments like ophthalmology, surgery, dermatology, and so on. Developing networks by working in partnership with patients, couriers, service users and their representatives, and colleagues within and across systems to deliver and improve services. Planning and managing resources, people, and performance in order to improve services. And in third place, experience, capacity, and ability to manage organizations like hospitals, like clinics, like health centers, but also like medical associations at the national or international level. The other part is to present a project of management of a medical department. First of all, managing services, doctors showing effective leadership are focused on the success of the organization, of course, in which they work. So this requires doctors to demonstrate the competence in planning by actively contributing to plans to achieve the service goals, by managing resources, by knowing the resources available and using their influence to ensure that resources are used efficiently and safely and reflect the diversity of needs, managing people by providing direction, reviewing performance, motivating others and promoting equality and diversity, and also managing performance by holding themselves and others accountable for service outcomes. So this is the first part. The second part of the project is improving services. Doctors showing effective leadership make a real difference to people's health by delivering high quality services and by developing improvements to service. This requires doctors to demonstrate the competence in ensuring patient safety by assessing and managing risk to patients associated with service developments, conducting clinical evaluations by being able to think analytically and conceptually, and to identify where services can be improved, to see its strengths and its weaknesses, encourage improvement and innovation by creating a climate of continuous service improvement, facilitating transformation by actively contributing to change process that lead to improving healthcare. And finally, the third part of the project is setting direction. So doctors showing effective leadership contribute to the strategy and aspirations of the organization and act in a manner consistent with its values. This requires doctors to demonstrate the competence in identifying the context for change by being aware of the range of factors to be taken into account, applying knowledge and evidence by gathering information to produce an evidence-based challenge to systems and processes in order to identify opportunities for service improvements, making, of course, good decisions based on their values and the evidence, and finally, evaluating the impact by measuring and evaluating outcomes, taking corrective action when necessary, and being held to account for their decision. So these are the three parts of the project that the doctors should present when they apply to the fellowship on clinical leadership. Then how is it make the assessment, the evaluation? We put all these points, and I will show you for the CV evaluation, as I told you, demonstrating personal qualities with technical professional skills, time spent in practice, education activities as trainer, and leadership skills with experience, capacity, and ability to manage teams, service, and organizations. And each of these points has an evaluation in a total of 6. For the second part, which means the project of management of a medical department, also the 3 chapters I told you, managing services, improving service, setting directions, and also a point for the presentation of the project. So in a total of 4 points. So this will be evaluated in a total of 10, 6 for the first part, 4 for this second part, and then the jury will approve or not the candidate for having this fellowship in clinical leadership. So this is my last slide. Thank you very much for your attention. Thank you.
Thank you, João. It is a pleasure always to hear this, and as you could see, dear friends, we try to accommodate also, so besides the trainees, the ones among us who have already experience in clinical leadership, and we can easily assess them and grant them the fellowship of this European Clinical Leadership Academy. The next step is really logical, to speak what happens to the trainees, and this is the main body of the ETRs, which we developed together with UEMS and other UMOs. So let me share. All right. So we we speak now about the training requirements for the trainees, and I will take the field who was already presented by the and the structure of these training requirements involves three parts. One is the content outcome. The second is how we organize it. And very logically, the third is how we assess, how we will evaluate the candidates. Let's begin with the first one, which is the content. And this has at its turn three parts, as it is very usual for a training and for an academic development. First is knowledge. And as you see, you will see, we will have for each one different parts. The second is, of course, skills. And the third is competencies, behaviors, attitudes. So the first one, knowledge, is related to the teamwork, to the individual and collective performance, to the best practice, to how to communicate, and ethical aspects. These are the first five, and we have another five. The knowledge in management, in risk management, in governance and legislation, in quality improvement, and research. It is easier, as you can see, that we have 10 each to assess the candidates. So that was knowledge. The second one is skills, again, with 10 parts, 10 items. Critical self-awareness, the skill to be able to lead the team, to extend or to work in an extended collaborative environment, to have effective relationships and to communicate effectively, and to empower people. Also, to manage the team, the service, and the activities, to implement and to audit the change, to manage the conditions, the working conditions and resources, to improve medical practice at the end of course, and to promote research. The competencies are related to the personal growth, and we think it is very important, and it is very fulfilling of the participants and of the candidates to go through this journey of personal growth, which is offered by the Academy, to have the competence of the team leadership, to have a patient-focused approach, the personal qualities, of course, which are related to the personal growth, the liability in governance, and then the governance knowledge and the support of the governance, the attitude and the competence of an excellent professional conduct, the ability to manage resources, a very good communication, which you already saw in the knowledge and in the skills. And finally, as you have seen already the change, then is the competence to improve and change the environment for the benefit of all the involved parties. So this is the content. Now, how we organize it? Well, the first is the training itself per se. And we thought of having 2 hours. These are, the board will assess different activities and will grant hours to the different activities. But at the same time, we'll also accept all the ECMEX granted by UEMS into activities which are related to the clinical leadership or to the parts of those activities which are related, which are dealing with clinical leadership and the specific ECMEX which will be taken on board as granted. And also, as you saw the different sections, we will ask 4 hours or ECMEX per section. And this section are 4, and you can see there is a flexibility because 4/40 is not 200, so there will be a flexibility. The different sections are the position, experience in leadership, leadership in projects, medical, social, innovation within the team. That would be 1. The second is education and training, economic and managerial. Also relevant education in specific medical, legal, and regulation. The third is communicating and organizing. I mean, education and training in communication, and at the same time, or on the other hand, the position of chair or reporter of meetings or of working groups. And the fourth are relevant schools, winter, summer schools, conferences, congresses, workshops, as I already said. This is the general schedule of the training in which the candidate should have at least 40 hours or ECMEX per section in a total of 200. Now, how we assess the candidate? Well, it will be a first part, which will be the eligibility assessment. And that is, of course, proving that the applicant is a physician, and the hours or ECMEX I already told you, or an MBA relevant for the clinical leadership and training. That is the eligibility. And the second is the assessment per se, which will offer us to the possibility to assess the portfolio of the applicant, of those already described sections and hours or ECMEX. And we will have assessment of the acquisition of those knowledge, skills, and competencies, with the special emphasis of the impact on the patients and on the healthcare system. So these are the 3 parts of the organization for the ETR for the trainees, which are embedded in our European Clinical Leadership Academy. The first one being the content, knowledge, skills, and competencies. The second one will being the organization for the training and the curriculum. And the last one being the assessment, which with its 2 parts, the assessment of the eligibility of the candidate and the evaluation. And I thank you for that. Now, it is also a logical follow-up. I would like to see if, okay, I said stop share, okay. If João Grêmio joined us. Are you with us, João? All right. João told us that he might be involved in a medical procedure. So as we are doctors, we know that we are depending on what we do. And for the surgeons, we know when we go in, especially if it is an emergency, but we don't know when we go out. So if João is not with us, João, you are not, all right? If João is not with us, then I think that we will express again the honor and the pleasure of having the presidents of the EMOs present at this meeting. And as you, dear President of AEMH, you already mentioned them, could you invite them at turn to say if they want to some words?
Dear presidents of the European medical associations and organizations present, I ask you to take the floor and to address the audience and tell us the opinion of your organization. I start by alphabetical order. The first one is Dr. José Santos, President of CEO. Please, dear José.
Thank you, dear Eric. Good morning, dear presidents, dear Eric Teo and Professor Vasilis Papalej, dear EMOS, dear participants. COM congratulates the European Academy of Clinical Leadership, AEMH and UEMS for this excellent, innovative clinical leadership project and for this magnificent organization. COM is also proud to be involved and to be present here today. There was a time when physicians were only considered capable of carrying out their specific clinical functions, and the management and clinical leadership were far from their horizons. Luckily, this mentality has been changing to a more comprehensive form, with patients in the center of the process and professionals in the center of this change. Regardless of the different European health systems and the different health budgets of the different member states, they are inalienable medical principles that must always be followed. It cannot be forgotten. Ethical and deontological matters, patient safety, quality of care, and others are the main goals to follow on a clinical practice. The learning of leadership skills as the clinical management, strategic planning, team building and communication, human resource, marketing and other skills associated with the knowledge of clinical practice, and why not the introduction of the positive device concept, will be able to make the natural leader for managing different models and health units. For COM goals, I must emphasize the importance of the physicians in clinical leadership in order to provide appealing work conditions, organizational capacity, strengthen the doctor-patient relationship, and on the improvement of health quality. Only through this way, we were able to generate conditions to prevent situations as burnout and as violence, which nowadays are a scourge for health professionals and their families. Thank you, and once again, congratulations. Thank you.
Thank you very much for your warm words, for your support, for your help. This is quite valuable, and we couldn't proceed, we couldn't have success without the very strong help of your and the other EMOs in the European context. So I want to give the floor to Saradas, Secretary General of CPME. Saradas, do you want to say a few words to us?
Yes, good morning, Dr. Meerholz. Good morning, Professor Papalouis. Good morning, all colleagues. Thank you very much for this interesting presentation. And please allow me to convey the apologies of the President and the Secretary General of CPME, who unfortunately couldn't be here today due to prior appointments. But I see also that one of our Vice Presidents is here. Just to say, yes, I remember that in the past there have been many joint statements on the importance of doctors' role in the healthcare system, of the importance of doctors taking the lead also on continuing professional development, on lifelong learning, and congratulations on this very concrete example of implementing these political commitments. This is a very interesting project. And we wish you all the best for the launch of the Academy, and we'll be sure to follow with great interest and hope also to have updates on the progress made in the coming months and years. Thank you very much and all the best.
Thank you very much for your warm words, and I'm very happy that CPME is also collaborating in this very important issue. And so I'm very optimistic that this baby which was just born this morning is going to be a big boy or a big girl in the near future. So I want to ask Matthias Körner, as president of EJD, do you want to have the floor? You have it.
Yes, thank you very much. First of all, congratulations to the achievement of launching the European Clinical Leadership Academy after years of developing those structures. And EJD appreciates the efforts of AEMH and UEMS to further educate our colleagues to be better prepared to face the challenges of our healthcare systems across Europe. As outlined in different presentations, the clinical leaders play an important role in very different aspects of working as doctors, and strengthening this role will ultimately be beneficial for healthcare institutions, colleagues, and finally patients. Besides that, EJD appreciates the option to be part of the executive board and will support the EACL as best as possible. Thank you very much.
Thank you. It's very important to have the junior doctors in the boat, because you are the future and you are the future clinical leaders. And so it's essential that you participate with your organization and as a person. I'm very happy to have you in the working group of clinical leadership, which is governing and constructing this academy. So I want to give the floor to EMSA, to Alexandra Arsho-Doulakis.
Yes, thank you so much. I hope that you can all hear me well. Good morning from our side as well. We want to also congratulate you all for the launch of this important initiative. As we all know, doctors tend to have a little bit of a different viewpoint on, let's say, financial situations in hospital as adverse than people who are not from the healthcare background. We couldn't agree more that doctors should be more empowered and more implemented in these decision-making processes, and that management and leadership are key in that regard. But and also just in recent years, throughout the development of this academy, especially during the pandemic, the frustration of not having physicians in leadership positions became especially apparent in some hospitals, where decisions were suddenly made on length of stay of COVID-19 patients in ICU wards without consulting maybe the clinical leaders themselves as well. But this, I want to go at this a little bit from a different viewpoint, because we didn't prepare a proper statement formally, simply because, and I think this is actually key, and this describes more than I could put into words, upon me asking our board what they would want me to say at this event, at this in this chance of speaking. Mind you, these are all people who are in leadership positions in student bodies, either nationally, locally, or European on the European level. 99% didn't know what clinical leadership meant, which I think describes the problem that we're having. And I think I want to just underline that the basis for all of this to evolve is also medical school, for people to understand that there is the possibility even to be active in clinical leadership positions in hospitals, rather than just, let's say, becoming chiefs of surgery or chiefs of different department, but actually being able to make these decisions. And we want to just express our sincere gratitude for this Clinical Leadership Academy, and also support you in any way we can through spreading this message also through the student body to engage more students in in this pathway as well.
Thank you very much for your statement, and you are the future, and you are the clinical leaders of the years to come. And so it's very important that you join our efforts and that you have an input in the development of this European Academy, which is a very broad instrument to implement our wishes, our aims, and the things we want to have changed in hospitals and in any other institutions, medical institutions all over Europe. And this is why we have such a broad scope of possibilities to become a member of this academy, from the young to the experienced to the older doctors working in institutions and or hospitals or any place where you are needed as a doctor with your medical background. So last not least, I want to give the floor to Dr. Bumbulut, who's the president of UEMO.
Thank you, dear colleagues. While effective clinical leadership have been offered up as a way of ensuring optimal care and overcoming the problems of the clinical workplace, a standard definition of what defines effective clinical leadership remains elusive. In some ways, it is easier to consider what constitutes poor or ineffective clinical leadership. Effective clinical leaders have been characterized as having advocacy skills and the ability to affect change. They have been linked to facilitating and maintaining healthier workplaces by driving cultural change among all health professionals in the workplace. To achieve these positive outcomes, clinical leaders need to be seen as credible, that is, be recognized by colleagues as having clinical competence and have the skills and capacity to effectively support and communicate with members of multidisciplinary clinical teams. Also, clinical professionals may not have the necessary evidence-based knowledge regarding specific leadership styles to succeed in a leadership role. As it's seen, leadership, it's like the abominable snowman whose footprints are everywhere, but who is nowhere to be seen. This quote neatly encapsulates one of the problems about leadership. It is apparent that the theory of clinical leadership is in an early stage of development, and like leadership in general, in health, there is very limited empirical support for specific approaches to enacting effective models. The specificity of the activity of the family physicians and the organization of primary care across Europe makes us have to apply rather empirically the principles of clinical leadership. Models of success can be replicated in cascade in primary care. The dimensions of medical practices can facilitate this dissemination. We believe that leadership training processes between family physicians could be as well addressed. UMO looks forward to and supports your effort to develop an appropriate clinical leadership training framework such as EACL. Thank you, dear colleagues.
Thank you very much, Dr. Bumbulut, for your warm words and your best wishes. And this is quite right. We have to work together in all disciplines, in all fields of practice, because we are all doctors. This is the one thing connecting everybody in the whole of Europe and all the world. But we're talking about Europe, which is big enough as a continent. So we do need your support. We do need everybody's input to make this a strong, strong child. I don't want to conclude this point of the agenda before I give the floor to João Deus, who's going to talk to us as president of FEMS. Dear João, go ahead.
Thank you very much, Theo. Well, from the very beginning, FEMS joined the European Academy of Clinical Leadership project by the relevance it could represent in the future in many of the fields of expertise of our association. When we talk about the working conditions of doctors, salaries, working time, psychosocial conditions such as burnout or workload, job satisfaction, continuous training, medical immigration, and so on, we can understand, in addition to other conditions, of course, that only strong clinical leaders supported by adequate training can guarantee good results. Knowing how to motivate teams, improve the work environment, create conditions for the development of interpersonal relationships and empathy with patients favor the well-being of physicians and contribute to the improvement of clinical and even financial outcomes, as we saw. So our commitment to the Academy is a reflection of all this, and dealing with aspects such as risk management or task shifting can only be achieved if physicians assume in front of the society the leadership at the different levels of the organization of health units. The management of hospitals, services, departments must be based on patient safety and the quality of care provided. No one better than doctors will be able to achieve this goal by combining clinical knowledge with leadership skills. Socioeconomic inequalities in health, which is a big concern for FEMS, are unacceptable and represent one of Europe's greatest challenge for public health. The main challenge is to develop new and effective policies to address the determinants involved in these inequalities. So having a pool of doctors trained as clinical leaders can contribute a lot to reduce these health inequalities in European countries. So on behalf of FEMS, I wish to the Academy every success it deserves. Thank you very much.
Dear Joano, thank you very much for your warm words, for your remarks, and we are very happy to have you within our team and being the FEMS president at the same time, which makes it even more easy to communicate and to cooperate within the EMOs and with the EMOs and with European institutions. One point I want to point out that is that we are all inclusive, that we are certainly welcoming anybody and everybody from all over Europe, especially the ladies, the lady doctors, the female doctors, which are now becoming a majority of doctors in some countries, especially in Germany. We're going to have more than 50% lady doctors at the end of the year. So feel invited, dear female colleagues, dear ladies, to join our efforts. And we're going to stress the relationships, the importance of the relationships between the genders, and we're going to stress diversity. So everybody is, and everybody, whoever he is, not regarding his background or her background, is welcome and invited. So I want to give back the word to Vlad, because now Joano Grenio is with us and he can give his presentation.
Yes, I will join you, President, to thank and to be very satisfied with the presence and to the warm and expert words of the EMO's presidents or representatives. Certainly, we are very pleased to have them on board and to have everybody, and the keywords that you already said is inclusive. Coming back to João Grenio, I already said that he's not only the treasurer, so in the board of AEMH, but also General Secretary of UEMS. And in his capacity and with his personal experience, he contributed a lot to the development of the ETR, and he will speak to us about the mechanism. The mechanism, I mean, using the proved UEMS ETR methodology for the curriculum. João, you have the floor.
So, thank you very much, Vlad. Good morning to you all. It is a pleasure to see you all, and it is a pleasure to see that this academy and this project has developed so much interest across Europe. I apologize for being late, although clinical leadership is something you also have to do between your you have to include it in your responsibilities, and I'm on ER today, so that was the reason I was a little late. And also, although we might be as clinical leaders as we want, we will never control the force, the dark force of Wi-Fi, and that made me late also because I had connection problems. So I apologize very much for being late. I will try to compensate you with my presentation. Just to say that it is for me a big pleasure to be presenting, to be here, and to have been a part of this project. Especially because, as you can see in my presentation, this project is a little like I am. It has a foundation in two, it has its foundations in the two organizations, like myself, who am Secretary General of one of them and also Treasurer of the other. So I will try to briefly make a little explanation how did we get to this curriculum and to this ETR that was presented, that was very well presented by João Deus and Vlad Tika to you all. I will try to explain what was the methodology that the working group of this European Academy of Clinical Leadership used, and that was very much something that we dreamed directly from UEMS. So, like I said, and just to make a little conflict of interest, the declaration, I'm a general surgery specialist in Hospital de Loures, which is in the outskirts of Lisbon in Portugal, in sunny Portugal. I am the UEMS Secretary General, and because of it, I'm also the head of the European Accreditation Council for Continuing Medical Education. I am also the treasurer of AEMH, and I've been for the past 3 to 4 years, I believe, a member of the working group to establish this European Academy of Clinical Leadership. So, very briefly, most of you know that this is for the ones who don't know what or who UEMS is or what UEMS is. UEMS is the oldest European medical organization. It was founded on the 20th of July of 1958, and it aimed to translate the ideas and ideas by the national medical associations of the 20. It has also 4 associate members, 5 observers. It has 60 specialist bodies. Its objectives are to promote the free movement of medical postgraduate medical training, continuing medical education and professional development, and also in quality assurance in the specialist medical practice. We have to be very aware of where we are at each moment, and the fact, and we know that there is a new world and we are faced with new realities every day. is perfectly established that we have free movement of healthcare professionals across Europe. We have free movement of patients. Healthcare systems across Europe are interdependent. And we also know that in many countries, the assessment of the formal education, of the training and the competences and the professional development of medical specialists either do not exist, are not we also have a question of an aging population. This aging population is comorbidities, but also with emphasis put on the quality of life of these individuals. And we also have to take into care and into attention the care that is needed for the vulnerable, either the minorities or in which the patient is also an expert on himself and his life. We have progressed from a time in which the doctor was almost like a god to the patient that knew all and to whom the patient should submit freely, to a time in which we live today, in which the patient is to be seen or should be seen as a colleague in the decision that we are faced with. When dealing with these questions, we are faced with the organization of the healthcare services across Europe is subsidiary. The differences in the health care system harmonization, and that is something that we will always defend. So, and striving for this harmonization, what are the tools that we use and how do we do it? Well, we have our focus on specialist practices and inpatient care. At society, Europe, the world, and always we use center appraisal, and of course we use IACME to achieve this. So for this presentation, I will now focus on the ETRs and the assessments, because these were the main issues and the main points that we covered when dealing with our ETR. What are ETRs? ETRs are European training assessments. Yes.
João, maybe it seems that you have connection problems. Maybe you can stop the video, and maybe if you stop the video, maybe the connection will be better. Try this so we can, because we don't hear you all the time and the presentation.
Okay, just give me just a second. Like this?
Yes, like this. Let's try it this way.
But you are unable to see my screen, right?
Yes, we see your screen very well.
Okay, very well. Good. Let's see if this can be, if I can drive this home without any further problems. Thank you for forwarding the medical practices and the current scientific findings. And for this, we use our UEMS sections, boards, divisions, and MJCs, who are the ones who develop the European standards. Of course, we know that the definition of the postgraduate training content is a competence of the respective national authorities. So the ETR is not a definition of postgraduate training. The ETR aims to complement postgraduate training programs and ensure that high quality training is provided across Europe. When doing this, we involve, when elaborating the ETR, we aim and strive always to involve the relevant UEMS section, the national scientific societies represented in the section, the relevant European scientific societies, and we also strive to have as broad a consultation as possible at a national and European level. So for this, we go to our colleagues at universities, colleges, professional organizations, and we try to get all of these inputs in the documents that we make. So we insist on having a wide and in-depth discussion about the training requirements, be it clinical, academic, professional, the standards of clinical care, the accreditation of trainers, and also the appraisal and accreditation of training centers. We also take a very close look at the content and the format of the assessments, and for this we Europe and beyond, the United States, Canada, and all other countries in which assessments are made. We also consult with already established European boards which do assessments, although it might be in other clinical areas, but we use them. We are open always to innovative ideas. We have established in many specialties preparatory courses to the assessments, and we make sure and we strive to, and it is a point of honor to UEMS, that all of this is affordable to the candidate and we don't have any failure rate fixed. So this is the most important part of all of this. All the work that is done in the European training requirements and the assessments, it is to be achieved, if possible, through the consensus of all parties involved. And we are the highest commonly agreed standards between all players. And this is very important. So, after all the consensus is this document to the ETR committee, which is composed of experienced UEMS colleagues who review the ETR and see if it is according to UEMS ETR's specificities. And if we get the approval from the ETR committee, we then circulate the document to all of the UEMS constituency to have and gather more opinions on the ETR and to make changes to the ETR whenever needed. Finally, after a grueling process, the revised documents are submitted to the UEMS Council. They are presented in the advisory board, in which vote is given two associations in the UEMS Council, and the ETR is finally approved and to be rewritten or redone some parts of it. And this coming here and finishing my presentation, and this was the process that we used during this European Academy of Clinical Leadership. It is a work of 4 years, always in close contact between the organizations and between the working group and between the members of the working group. We had countless meetings. All of this that I just described, that it looks very, very out there. It was exactly what was presented to you, and it was exactly this methodology that we used to do DCTR, of which I myself, and I believe all other members of this working group are very, very proud. Thank you so much, and again, apologies for my delay.
Thank you, João. Anyway, I think that many of us, which was very well developed by the UEMS. And we saw, generally we saw very well the slides. So the information, I hope, passed well. I saw that there was a lot of energy on the chat with suggestions, question and answer. And it is now the moment of Q&A session, which will be chaired by our friend and former secretary of the AEMH, Froe Sobat, and with the help of Diana, and of course with all of us. So you are just invited to take the microphone and discuss, comment, ask, and hopefully we'll be able to reply. I see that already Professor Papaloi raised the hand.
Thank you. Dear Vlad and dear colleagues, I must say in the first row how pleased I am with the number of participants today. I hope you can hear me. It's more than 100 participants interested in this topic. And after years of our common efforts, it's really a privilege to mediate this discussion. European Union is not a unique territory, and we have many different systems of management in hospitals in use. But I think that the importance, which is proven, importance of clinical leadership is generally important and is our common interest. Today we have heard a lot about aim, idea, and methodology. It was well explained and presented to us. But the process of clinical leadership academy development is an ongoing process, and it's something we will change with time, and we will appreciate your contributions. So we have some time provided for the discussions. As Vlad already said, many initiatives appeared in the chat during our meeting. And please don't hesitate to ask questions, or even we can afford some short comments. It goes without saying that we will not solve all the problems and explain all the details, technical details, but I will open the floor for the discussion, and I'm waiting for your contributions. Please raise hand.
There is already, Vasilis Papaloi already raised the hand.
Okay.
Sorry.
It's my pleasure to give the floor to the Papaloi.
Thank you so very much. First of all, sincere apologies for the connection problems that João had in his presentation, but I'm sure all of you got the gist of all the work that is being done within the UEMS about the EPRs, and all the dark forces of Wi-Fi, as João said, will never stop us from developing this project. Now, a couple of comments on what has been mentioned. Mr. Fodoulakis asked about the definition of clinical leadership. And I think it is a very, very crucial question. And from what I heard this morning, the best answer came from Dr. Bumbulut, who said that clinical leadership is to be able to affect change and implement change where you are and where you work, in a positive way, of course. And I think this definition of each one of us being a clinical leader, having the ability to do it and do it in the environment we work and live is the very definition of it. The implementation, the progress of change. So I think this is the best definition I can think of, quite frankly. The second thing that came from the discussion today, and I saw some comments in the chat, is that we need to see the medical specialist not only as the leader of a clinical team, but as of a healthcare team. We don't practice independently. We don't practice on our own. We practice in an environment which is very complex and has nursing staff and other healthcare professionals, and we should always see ourselves as part of it. Yes, we are the conductor of the orchestra, but we are part of it. And it's they are equally, valued members of the team. And I think we need to make this an integral part of seeing clinical leadership. And the last thing about the scope, I think that the core program was presented today in a very robust way, but already we need to explore areas where you can translate these into positive recommendations. First of all, to do some proper research to explore areas where more work is needed in the area of clinical leadership. Another example that came in the chat is to try to convert technology from being a scope and an ends, but to being a means, from being a tyrant to being a servant of the clinicians. And this is, there are ways to do this, or also to promote diversity and inclusivity. So beyond the core program, I think that this group and the EMOs, we need to start exploring specific areas in our practice where we can have targeted interventions and facilitate progress. Thank you.
May I, Freud, to
Yes, of
comment?
course, of course.
Thank you, Vasilios, for your very appropriate remarks, and we will take on board your proposals. Just for the first point, the definition of clinical leadership, I invite you all to go on the preamble of the clinical leadership ETR, in which we said that clinical leadership is not restricted to people who hold designated medical leadership roles. And as you said, instead, leadership is shown through a shared sense of responsibility for the success of medical organization and its services. Acts of leadership can come from anyone in the organization as appropriate. Physicians are crucial in clinical leadership, and Clinical Leadership Academy is focused on the achievement of these, all the things we just said. Thank you.
Thank you, Vlad. I think it's not only the aim of the academy to do the research and theory of the leadership, but also to promote the idea among younger colleagues and to motivate them, support them to improve, to study, to compare themselves with the other colleagues. So any other questions, comments, ideas for improvement?
Can I speak?
Of course.
Good morning to everybody. Congratulations. It was very positive initiative. And I would like to say that I'm organizing next year in Rhodos Island the 21st World Congress about breast cancer and breast health care. Between the speakers, there are some very interesting things about this field of medicine, senology. I can have their address, emails in order to communicate with them. Have you understood?
I'm not sure that I have heard the whole message.
I repeat, I'm the president of the upcoming 21st World Congress of Senologic International Society next year in September, which will take place in Rhodos Island, 22 to 24 September. And I find very interesting things that have been said here, and I would like to communicate with the speakers. May I have a catalog with the names and I noticed the name to find email or telephone connections in order to include them in the scientific program of the Congress.
Okay, I think now I understood you're interested in having some presentation on this topic during your Congress next year, if I understood correctly.
Yes, yes, 1, 2 speakers.
I think it's a simple technical question. Our secretary will provide some contact to you.
And of course, everybody is welcome if you like to participate or to come to Rhodos Island.
Thank you very much.
Freya, there are hands up, Freya.
There are hands on some. Okay. See.
Chantal de Calossi, for instance, first, and Sefron, and then there are 3.
Okay, we have 3 speakers. Yeah.
Okay, thank you. Thank you for the nice presentations, but I have a question. What would be the advantage of this training compared to an MBA?
Okay, what can you answer?
Yeah, we can say some things. So first, let's speak about the disadvantage. The disadvantage is the MBA could be granted by the academy, by university, and it might be asked for some employer, which specifically asks for MBAs. The advantage of the academy is multifold. First, it encompasses more items than an MBA. We are not aware of MBAs dealing specifically or only to the clinical leadership. So it will be a broader approach, and second, more focused to doctors, to the ones we are, and maybe especially for the clinical doctors, whatever specialty, whoever they work. The third advantage is that these certificates or fellowship will be granted by the one European association or by multitude of European association. Already we have 2, the AEMH and UEMS, which are reputed European associations. And this way, the certificate will have the value of the pan-European approach.
Okay, thank you.
Okay, thank you for asking. This is a very, very pertinent, very valuable question, and maybe many of us would ask themselves or us this question.
Okay, thank you.
Thank you very much. Next question, Mr. Safon.
Hello, good morning.
Good morning.
You are could you please unmute the microphone? No, again.
Unmute.
Again, unmute your microphone.
Nope, still not.
Branche ton micro, Jean-François, s'il te plaît.
It's okay. It's okay now.
Alors, il doit y avoir un problème. Il est branché.
Non, c'est bien maintenant, c'est bon.
I want to congratulate everybody for this initiative. And the French Medical Council is very much interested in getting involved in this work. There is a problem for us in France that we are lacking of doctors, and investing in leadership takes time. And doctors are too far from administrative decision, but probably if we are more on the leadership, we will not be close to our patients. That is the problem I want to tell you.
Okay, thanks. Mr. Griswold.
Yes, thank you very much. I just wanted to make a short comment. One is, I think this is a fantastic initiative, And we should be aware that we should implement the thought of leadership even in student education. And I think being part of a team, having patients, having relatives, even a student or a young doctor is already a leader in some way. And the second point is, I want to make that the American Academy of Neurology has been training advocacy and leadership together, and they've done wonderful courses which are called Palatucci courses. And it may be worthwhile to look at those, as they have systematically trained leadership and advocacy for neurologists. I just wanted to make this as a contribution for your wonderful work. Thank you very much.
Thank you for your opinion. I totally agree. That's why we have our medical students and junior doctors with us. The leadership training should be included on all levels of education, it's for sure.
Thank you.
Just a comment, if you allow me, Freud, to address the previous comment, dear Dr. Seffron. It is true that managerial tasks or leadership tasks can they can allow us in the relationship with the patients two very important things. One, resources and organization, so we can be better providing medical care. And second, the team, because as you know, it is very difficult to work without a team, and leading means having followers. So those two or three steps or parts of this clinical leadership may take some time, but may offer us more efficiency in the time spent with our patients.
And if I may add, as Dr. Merholz already said, we are all inclusive. This is only the first and very important step to bring the whole idea in front of the public, of the medical profession. And
we welcome the French Medical Council who wants to be involved, really.
Of course, all are welcome. And if I see no hands raised, I think it's time, we are just in time, it's time to give floor back to the President, Dr. Merholz, for some final remarks.
There is just, I'm sorry, Freud, there is a comment on the chat posted by friends who does, and I think that he cannot speak, he has no video. And he says, and you can see that he wants to emphasize the skills, working conditions. Well, it's long, and I didn't have the time to read all the message, but I don't know if you want to say something, maybe without camera, even if you don't have the video.
I see the message. It's very detailed and profound. I think it requires a more detailed discussion than.
Yeah, and I see something.
It goes beyond the scope of this meeting, I think.
And I see something very constructive, because it ends with the sentence of the UEMS Occupational Medicine section is happy to provide input to the academy. So that's okay. That's very good.
So they are welcome also as well. So. Dr. Merholz.
Thank you to everybody. This is a fantastic conference ending in a couple of minutes, and I'm very happy that so many different organizations, specialties, disciplines, sectors of medicine, practiced and clinical medicine and investigative medicine are combining in this effort to found this Academy of Clinical Leadership, this European Academy. I excuse the problems with the transmission, but this is the thing we have to cope with as long as we cannot meet in person. And I'm sure we're going to meet in person next year, next spring, next summer, when the pandemic is hopefully over. So, dear colleagues, ladies and gentlemen, I want to thank everybody who participated in this webinar launching the European Academy of Clinical Leadership. This was an impressive presentation of the history, the construction, the ideas, and the contents of the new academy. Our aim is to demonstrate that doctors are natural clinical leaders. Therefore, the foundation of the academy is a milestone for this objective. We plan to award the first fellowships of the European Academy of Clinical Leadership on the 12th of May 2022 in Austria at the joint meeting of AEMH and FEMS. The fellows of the European Academy will be awarded a diploma of mastership in clinical leadership. All information regarding the application procedure will be available shortly on the webpage of the Academy. We will keep you informed. Please check the homepage regularly for details. Once again, my thanks to all and everybody participating and preparing this event. I wish you a very pleasant weekend and hope to see you soon in the future. Thank you, everybody.
Thank you. Bye.
Thank you for organizing it.
Thank you very much.
Thank you for being with us.
Thank you. Thank you.
Thank you so much. Bye-bye.
Thank you.
Bye-bye.
Nice weekend.
Good.
Yeah.
Bye.
Bye-bye. Bye-bye.
Thank you.
Disseste bye-bye.
Bye-bye.
Yeah. Have a nice day.
Bye-bye.
Goodbye to everyone.
Estás com vídeo e som? Atenção.
Pessoas.